Hello everybody, I am Dr. Richa Katiyar, Managing Director and Fertility Specialist at Hope Fertility, New Delhi, India. We are living in very difficult times now. The entire world is under the grip of the COVID-19 infection and the whole of India is under complete lockdown. The Government of India has strongly advised all its citizens to stay indoors as this virus is extremely communicable and the need of the hour is social distancing. As a consequence of that, many pregnant patients are unable to go and meet their doctors and they are very apprehensive regarding their pregnancies and their treatments. On a daily basis, I get many queries from patients and I have to do all the best I can to allay their fears. So I have made a compilation of most of the common questions which patients are asking me and I will try to clear all doubts and queries in this video. If I get more queries in the future, I will try making another video for the same. So we come to the first question which has been written to me by Ekta, and this is among the most common questions which I receive. Ekta has written that she is pregnant and it is time for her scheduled visit to me. So should I come and meet me? So Ekta, the blanket answer is no. I am very sorry about that. If it is the scheduled time for you to go and meet your doctor, the first thing you have to do is to take a picture, a very clear picture which the doctor can read and send it to your doctor on WhatsApp. The doctor, you can follow this sending of the prescriptions photograph to the doctor with a phone call and discuss your case with the doctor. If the pregnancy is uncomplicated and if the things are going fine and there is no need in the treatment, then you need not go and visit the doctor at all. Every time you are venturing out of the house, you are running the risk of infecting yourself and your near and dear ones. Having said this, there are many exceptions. Patients who have got very precious pregnancies, who are experiencing problems in their pregnancies, who are having bleeding, spotting, abdominal pain, risk of a miscarriage, will need to be seen by the doctor. But do not venture forth to meet your doctor just because it is the time for your scheduled visit. First thing is, discuss the case with your doctor. If it is not important for you to go, then please do not go. Make the necessary changes in your treatment as advised by the doctor while staying at home. So the next question which has been written by Sunny is that she is running out of her medicines, although the doctor has said that she needs to continue the same. So Sunny, most e-tailers are delivering medicines to your houses and the Government of India has allowed all chemists to continue delivery of medication. What you need is a valid prescription with the doctor's stamp on it, and this prescription you can submit to your e-tailer who can deliver the medicines to your home, or a relative of yours can go to the chemist shop and get the medicines after following all the due precautions which should be followed while moving out of the house. There is no reason why you should not have all the medicines which you need to take, and you must continue taking all of them regularly. So the third question is from Roshni and she has written that she is due for her tetanus injection. So we all know that there are 2 doses of the tetanus toxoid injection which need to be given in pregnancy, and this is mandatory by the Government of India and it is in your own interest because it protects you and your baby from the tetanus disease. Now the rule is that the 2 doses of the tetanus injection should be spaced 1 month apart, and the second dose can be given as late as the 7th month of pregnancy. So if you are in your early pregnancy and you have already taken 1 tetanus injection, there is no need to worry. Even if you are in the 5th month, we are hoping that the lockdown will ease in 4 to 6 weeks. So you can take your tetanus injections as late as the first in the 6th month and the second in your 7th month. So please do not worry and go out of the house just to take your tetanus injection. Okay, now this question I have got from Neha and she wants to know how often does she need to sanitize her hands or wash her hands with soap and water. Okay Neha, if you are staying only at home and everybody in your house is also staying at home and not going out of the house at all, then you do not need to keep washing your hands or sanitizing your hands every hour, because the virus has not entered your house, because nobody is going out. You, as a rule, must wash your hands after using the toilet, before having your food, and if you think that your hands are dirty. But there is no need to keep washing your hands or sanitizing them every hour, or wiping everything in the house with 66% alcohol, because there is no infection. If there is no movement of people from inside the house and back. Now, what precautions does a person need to take during the visit to the doctor? This is a very important question. Come what may, some of you will need to go out to meet your doctor because of various reasons. And let us go step by step as to how we have to minimize the risk of infection. The first thing is that you should wear full clothes. You should wear clothes which are covering your arms up to the wrist. You should wear long pants or sari or chudidar, so that your ankles, up to your ankles, your legs are covered. You should preferably tie a scarf around your head. You should wear a mask. If you do not have a ready to use mask, you can fashion a mask out of a scarf or a t-shirt or a dupatta. If you have glasses, then you should put on your glasses. It is preferred not to put on your makeup, because people have a tendency of touching their face to settle their makeup, so that it is very important that you are not touching your face at all, because you can pick up the infection from your hands and then you can put it on your face, and this is how most of the infection enters inside the body. You should also not wear any jewelry or any watch. Please wear full shoes, proper shoes, don't wear sandals. After having made yourself completely ready like this, you can go to the doctor, who may be sitting in a private clinic or who may be in a hospital. You should always try to take an appointment for a time when the place is supposed to be least crowded, which is like early morning. Spend minimum time at the doctor's clinic. Maintain social distancing while you are sitting in the waiting room. If the waiting room of the doctor is small, you can stand outside while you wait for your turn. Do not engage in unnecessary conversation with anybody. Also ensure that in your doctor's clinic, they are maintaining due hygiene, taking all the precautions, that the doctor and the entire nursing staff is wearing gloves, masks, and taking good care of you and your health. Once you come back to your house, all the clothes which you have all the clothes which you have worn to the doctor's clinic should go into wash. You should wash your hands or sanitize your hands. Put your bag and your papers away in a place where you will not touch them for at least 2 to 3 days. If you need to touch any of the articles which you have carried with yourself to the doctor, then after you have touched the articles, you must wash your hands immediately. After having washed your hands, put all your stuff away. You must go and take a bath with soap and water, taking special care of the areas which you were open and exposed. I think that should cover all the precautions. Now, this is a question which I am getting asked very frequently, and it has been sent to me by Fatima. How dangerous can the COVID-19 infection be for me? And if I get infected, will the infection get passed on to my baby? Okay. So the COVID-19 infection leads to mild to moderate symptoms in most patients, and in very few patients does it become severe or leads to mortality. In pregnant patients, the trachea and the bronchioles of the breathing airway becomes a little thickened because of the effect of the hormones estrogen and progesterone. So it is very mildly more susceptible to the virus. Most women who are pregnant, and there have been many cases of women in China, etc., in China and in Italy, who have been pregnant and who have been exposed to the virus, and it has led to mild to moderate symptoms. Now, if unfortunately a pregnant woman does get infected, there has been no known case of the virus being transmitted from the mother to the baby. Such a transmission is called a vertical transmission, and cases of vertical transmission from the mother to the baby have not been found. However, once the baby has been born, it is very important that the baby is looked after properly with all due precautions, so that the baby does not get infected by its virtue of stay in the hospital or by the people who are looking after the baby. This is a routine question which I get from most patients. Can I have a normal delivery? Of course, why should you not have a normal delivery? There is no indication for an elective cesarean or an emergency cesarean just because of the coronavirus. Only if there were complications and you had to anyway have a cesarean will you have it. The coronavirus does not increase your chances of having a cesarean in any way. And now I'm coming to my last question of today's video conference. Is there any particular diet or exercise that I should follow in this time? Alright, so we all know that having a good immunity is a boon, and the vitamins which are very important for maintaining good immunity are vitamin C, vitamin A and vitamin E. So we should intake a good number of fruit every day, at least 2 fruit in the diet. You should follow whatever normal healthy diet you are taking. Must make sure you are eating 2 fruit and maybe some amount of lemon. People can also take vitamin C tablets. 1 tablet a day should suffice. There is no any other particular diet which needs to be followed. You can continue with whatever diet you are following in your pregnancy. Like hypertensive women should have less of salt, diabetic women should have less of sugar and carbohydrates. As regards exercise, unfortunately we are not allowed to go out. So if you were pregnant and you were walking for 30 minutes or 45 minutes every evening, you will have to continue to do that inside your house. You can continue to do gentle yoga in place of walking if you do not have enough space in your house to walk. Maintain a good level of fitness with whatever form of exercise or yoga you choose to do. With that, I come to the end of today's video. I hope that I have answered all the questions which all of you are asking to your level of satisfaction. If I receive more questions, I will attend to them in yet another video conference. Stay indoors, stay safe, stay healthy. Bye-bye.